All right, good afternoon, Mr. Johnson. It's so nice to meet you. My name's Sarah, and I'm going to be your speech pathologist. So I read your case history, and I've noticed that you've been having some trouble with your swallow, and you remember that we did do that bedside evaluation where I had you try a couple of different consistencies just to see how you were doing. And then we finally did bring you into the radiology department to have the modified barium swallow where you drank a bunch of stuff under the x-ray, and I actually have the results of that to share with you now. So we're going to go over that. I'm going to briefly explain what you're looking at here. So you'll notice here you can kind of see your mouth and your fillings. And so here, this white space is actually your airway. So that's why it's a lot lighter. Yep. And then here's your spinal cord. And then you'll notice that this tiny little thing is something called your vallecula. So it's this little bit of space that kind of comes over to cover your airway when you swallow, because we don't want anything going down there. And this darker space is your esophagus, which opens up while you swallow the liquids. So while we're watching this, you're going to notice a lot of darker fluids and solids going down there, and that's the food with the dye, so you can see it on the x-ray. So we're going to watch a couple of these, and I'll explain to you what's going on and what we found. Okay, so on this first one, you'll notice that you swallowed something that was water, and as you can see, it ran down fairly quickly. You had a little bit of darker water still left in your mouth, and that was oral residue, which we want to work on getting rid of. And then remember, you did the chin tuck where we had you look down, and then you ended up coughing. So you actually did aspirate on that liquid, which means that the liquid went down your air pipe, which we do not want. And then we're going to look at a couple of more. Okay, and you'll also notice that when you did drink the thin liquid, you had a lot of residue built up in that vallecula that we talked about earlier, that little space where your epiglottis flips over to cover your airway. And we don't want residue in there because it is at risk for going down your airway, which is again not great, because as you continue to take down more liquid, more and more residue built up in that space. And now we had you also eat that cracker. So while you were eating that, it took a while for you to chew and swallow that, and you had residue not only in your vallecula, but right outside of your esophagus and right next to your air pipe. So if you have your windpipe right here and your esophagus, residue will build up in this area, which is at risk for going down in here, because when you're not swallowing, your airway's open so you can breathe. And the more residue that builds up in there, the more at risk it is for going down your airway. So that's what we noticed with the solids, which is why we had you do that left head turn, if you remember. So when you turn your head to the left, let's watch and see what happens. So when you turn your head to the left, it actually helps reduce a lot of that extra food that was built up next to your airway. So that was extremely beneficial. And then when we implemented it for when you swallow the liquid, we also noticed that your airway was better protected and you had less residue. So you were less at risk for having that liquid and food go down into your lungs and preventing infection. So that was great. All right. Now, do you have any questions before I move on from the video and talk about?
Yeah, I have one question. Why is it bad for residue to enter the airway?
So when it actually goes down into your lungs, it's hard for your body to kind of fight the bacteria that comes down with it, because not only do you have bacteria from food, just kind of, imagine if you leave something out on the counter for a while, bacteria kind of builds up on it, but you also do have bacteria in your mouth. And when the food that's been in contact with the bacteria in your mouth goes down to your lungs, it's at greater risk for developing an infection like pneumonia. And we really don't want that, especially with your heart condition. Okay, so let's talk about some of the recommendations that I have for your swallow. So you are okay to eat all the foods that you normally would. It's just that we want you to stay away from mixed consistencies, which would be something like cereal or fruit cups, because remember when we did that bedside evaluation, you had difficulty not choking or coughing while you ate the food that was mixed because of the liquid and the solid. It was hard for you to maintain that. So we want to avoid that. Also, I want you to avoid having caffeine and coffee and teas like that, because actually that dries out and dehydrates you, and we want to work on keeping you very hydrated, especially because we're trying to modify your diet to keep you well maintained.
So no coffee.
No coffee, but if you do have to have coffee, you should have it without cream and sugar.
Okay, I can do that.
Okay, good. I also, like right now, I want you to be eating in an upright position. I'm just saying, if you do have a recliner at home and you like to recline and eat snacks while you watch TV, please do not do that. It puts you at more risk for having things go down your windpipe and you choking, and we really don't want that. So I want you to eat in an upright position and stay upright for approximately 30 minutes afterwards. Okay. And we're going to go through some safe swallow strategies with you. So these are just things that you can implement while eating and drinking liquids to make sure that you aren't aspirating any of that. So the first would be whenever you eat foods, you notice how we talked about that residue? So with the residue, after you take a dry swallow, so you swallow nothing, like swallow right now. So that would be a dry swallow. And after you do that, it actually reduces a lot of the residue that you have built up, which we noticed on the MBS. Also, yes, so I want you to do that after every time you take a bite. Also, we're going to have you do a left head turn every time you eat solids. We're going to have you do a left head turn and a breath hold, because if you do a breath hold, it actually closes your airway. So when you do that with drinking liquids, it'll just ensure that your airway is better protected, because liquids do run back very quickly. So we just want to avoid any of that going down your airway. We also had you take that sample pill, remember, during that MBS. And so we're going to have you take pills instead of with water, because we just talked about how mixed consistencies are kind of difficult. If you could take your pills with a pudding or a puree, that would be wonderful. And so when I meet with you next, we're going to have you practice some of the safe swallow strategies, and then we're going to go through some therapy, because you don't want to be reliant on these strategies forever, right?
No.
So we're going to start therapy to work towards improving your swallow to make it easier for you to swallow and safer. And I do have all this written down for you to take home, but we'll go through it again when I meet with you next time. And welcome back. It's so good to see you again. How have you been doing?
So good to see you too. Thank you.
So glad. All right, so like I talked about earlier, we're going to practice some of those safe swallow strategies that you can do at home in the meantime while we're doing therapy to work to improve your swallow overall. So this is what you can be doing in the meantime when you go home and you eat, until we can use therapy to improve your swallow, so you don't have to be as reliant on these strategies. Sound good?
Mm-hmm.
Okay, so the first one we're going to go through
Okay.
is the left head turn with a breath hold. So you're going to turn your head to the left, hold your breath, and then swallow the liquids.
Okay.
All right, so I want you to take small sips of water. How did that feel?
It felt better. I felt like I didn't have to cough.
That's really great, and it's wonderful. And notice how your voice doesn't sound at all wet or raspy, which is something you want to monitor. So if at any time that does happen at home while you're eating or drinking, I do want you to cough or kind of clear your throat to make sure that that doesn't happen again. So can you do that for me one more time? Excellent. And does this feel like something you're going to be able to do at home independently?
I think so.
Great. And I'm going to also give you a chart to track and make sure that you are doing these exercises at home while you're eating. All right, I'm going to take that from you. Thank you. Can you do a dry swallow for me? Excellent. And I want you to do that every time after you eat or drink something. So for every sip you take, you're going to do a dry swallow afterwards. I know you're still using that left head turn and breath hold, but we just want to make sure that, again, all that residue that tends to build up is being cleared out.
So I don't have to do a left head turn and breath hold for a dry swallow?
No, you do not.
Okay.
You just get to swallow normally.
Okay.
And if it would be helpful, sometimes it is helpful for patients if they do have an empty space on their plate or an empty bowl to the side where they pretend to take an air bite out of it, to remember to take this extra swallow, which if that would be helpful for you, you can do that. But whatever reminder you need to tell yourself, okay, after I just took that bite or that sip of liquid, I'm going to have to do a swallow.
Okay.
Okay. And now the next strategy we're going to do is you're going to do a left head turn again, but you don't have to hold your breath this time, and this is going to be for all solid foods.
Can I hold my breath
If you would feel more comfortable, yes, you can hold your breath.
Okay, but either's fine.
Either's fine for solid foods.
Okay. Sugar cracker.
I'm glad you like them. I'm going to ask you to do another dry swallow.
I have a lot of residue in my mouth.
Okay, thank you for letting me know that. Yeah, we are actually going to do some treatment techniques to help work on reducing that oral residue.
Oh, good. Because I feel it.
You feel it? Yeah. All right, but how did that feel overall in your throat, though?
It felt better.
Okay, do you feel like anything stuck in there?
A little, but not as much.
Okay, awesome. Can you do that for me one more time?
Do I have to eat all of these crackers?
Nope, you don't have to eat all of them. We're just doing it for practice to make sure that you feel comfortable doing it at home on your own.
Got stuck.
That's okay. It happens sometimes. Happens to me too. Awesome. Can you remember to take that dry swallow? Great job. And now something that I forgot to mention to you last week is that when you're eating, I want you to either brush your teeth or do an oral rinse of some kind to make sure that your mouth is clean, because like we talked about with that residue that can fall into your lungs, we want to make sure that having no or the least amount of bacteria that you can in your mouth to prevent that type of infection. So I'm going to have you either brush your teeth or do some sort of mouthwash rinse before and after your meals. Does that sound like something you can do?
I think so.
Okay, awesome. Thank you. So now what we're going to do is I'm going to talk about some of the different treatment techniques that we are going to be implementing to help improve your swallow. So the first is tongue exercises. So you just told me about how you feel a lot of oral residue in your mouth. And that's because, in part, you do have a bit of tongue weakness where foods will fall to the sides of your mouth, which is that where you're feeling most of your residue. So we're going to practice some tongue exercises to help improve the strength of your tongue so that that's not happening as much, and when you go to swallow the food, it's all in one bunch as opposed to falling all over the mouth. Okay, so the first is going to be tongue tip elevation. So I want you to stick out your tongue and lift it up and hold that for 10 seconds. Okay, good. And again. Awesome. Okay. And does that feel like something you feel comfortable doing? All right, and now the next we're going to do is something called a lingual sweep, but you're going to stick your tongue behind your teeth and brush it back across the roof of your mouth. Good job. Does that feel comfortable?
Yeah.
All right. I know that some of this, your tongue's going to kind of feel tired after a while, but that's okay. We're making it stronger.
Okay.
All right. And the next thing I'm going to have you do is say t, t, t. T, t, t. Good. And again. T, t, t. T, t, t. Awesome. All right. And then we're going to have you say s, sh, s, sh. S, sh, s, sh. Good, and again. S, sh, s, sh. S, sh, s, sh. Awesome. And that's just to kind of improve the movement of your tongue from front to back. And then we're going to do one more exercise. I know it feels kind of silly doing all of these. And you're going to say t, k, that one feel kind of harder than the others?
It's a little trickier.
That's all right. It's because you're moving your tongue from being so far in the front of your mouth all the way back. And since your tongue is a little bit weak, it's going to be a bit more difficult at first, but it should get better over time. And so we're going to have you do these exercises 3 times a day. And you're going to do each exercise 10 times each. And I do have a chart for you. And I also recommend that you don't do these exercises before you eat.
Okay.
Because we don't want your tongue to be all tired out and then you go and try and eat and have more residue in your mouth. That wouldn't be good.
Okay.
And then the next thing we're going to work on is something called the Masako maneuver. And this is essentially to help improve your tongue going back to touch the pharyngeal wall. So basically, your tongue comes back to touch this wall at the back of your mouth, and that creates pressure that helps push the food down. So remember we talked about all that residue that sits right next to your airway? It's because your tongue also partly doesn't come all the way back, which decreases the amount of pressure to push something down. So you need a lot of pressure downward to help move food down to your esophagus.
So the posterior wall is like the back of my throat?
Mm-hmm.
Okay.
Yep, so your tongue has to come and meet that, but your tongue doesn't come all the way back. So we want to work on improving that so that we have enough pressure to push the food down, kind of like how a piston goes down into something. It needs to have enough pressure to push that.
Okay.
Okay, so this is going to feel kind of silly, but you're going to hold the tip of your tongue between your teeth, like this, and you're going to try and swallow. Does that feel silly?
It's tricky.
It is tricky, but I promise it will get better with practice. So you're going to do it again. You can take breaks in between if you need to.
Okay.
But does that feel good? Does it feel like something you're going to be able to do?
Yeah.
We're going to do it again. One more time. Again. Excellent. Does that feel really difficult?
It's tricky.
Yeah, and you should never do that with food in your mouth. You're only going to do that on your saliva.
Okay.
And again, you're going to do that 3 times a day, 5 days a week, and you're going to do it 15 times. Because we want you to really practice to work on improving that.
Okay.
All right, now I'm going to give you a take-home sheet.
Oh, thank you.
This is for you.
Okay.
To, again, track all of your exercises to make sure that you're using your tongue sheet, and then also the sheet that I gave you last week with all of your take-home information about your diet. I still want you following all of the safe swallow strategies that we discussed here today.
Mm-hmm.
And then we're going to start working on improving and using those less as we build these strategies. So as your tongue gets stronger, as we work on improving that pressure to push the food down, you'll start to use these safe swallow strategies less and less.
Okay.
Do you have any questions for me?
I don't think so.
All right, awesome. It was wonderful seeing you today.
It was great seeing you too.
Okay, have a nice day.